These are facts that you all know about data, that there is incontrovertible evidence that early childhood health and development has long-term effects on life chances. And I think this data occasionally bears repeating, and bears repeating to the audiences that we speak to because they need reminding. And I think ECD, ECCE tends to sometimes get forgotten, but the data is very strong and continues. And in terms of the climate situation, we need to be very, very thoughtful because of the enormous impact of the climate on young children. Next slide, please. Just as far as data, I just want to show you a slide. It's not my own slide, it's a slide of my colleagues. This, to give you the kind of data that we're talking about and why we need to think about the world. Don't worry too much about it, but this is the kind of potential for data. This is a summary of the last 150 years of the intensity of tropical storms around the world, and you can see that they somehow reverse the map in a way I never quite understand, but with the Pacific and the Philippines and Asia right on the left, and you can just see where the tropical storms are. But I just wanted to give you a sense of what data can produce. Next slide, please. So just to go back to some of the data on why we need to be worried about the young years of life and why we need to think very carefully when we exclude children from the planning around climate problems, which if you go to the COP28, 29, and look at the number of times that children are thought about or mentioned, it's very, very minimal. UNICEF, amongst others, have been very brave and in fact called COP28 and 29 Children's COP. But I have to say, it was far from that. They were a long way off the agenda, and we're hopefully COP30 in Brazil will be much better. So just to give you some of the data from the Lancet Lancet Child and Adolescent Development and Health series in 2022, we presented data from 6 low middle income cohorts. One of them I have to tell you is from the Philippines, which is from Cebu Island, one from Guatemala, 2 from Brazil, 1 from India, and 1 from South Africa. And what they show is just how important the first 5 years are. That adversity and difficulties in the first 5 years, if they are not addressed, especially around nutrition, especially around development, has long-term consequences for growth, school completion, adult jobs, and adult intellectual development. And cognition early on is a very important predictor. But just to say that a good start is a great, great equalizer. If anybody thought that where you live matters entirely, that is wrong. In a large longitudinal study, of which I was part of, where we studied fetal growth, fetal brain development, from 13 weeks of life all the way to 2 years of life, across a range of countries, both high, middle, and low middle income countries, if you had an equivalent start in the early months of pregnancy, then you turned out exactly the same at 2 years of age, no matter where you lived, whether it was Kenya, India, Brazil, Italy, or United Kingdom. Also to say, importantly, there is reversibility, and a number of studies have shown that there's a lot you can do, so we mustn't give up when one has a difficult start. Next slide, please. I don't want to push the PISA data too hard, but just to remind us about preschool education. The data is strong, and if we have time at the end, then Chair, if you tell me if I'm running out of time, I would like to tell you a bit about the issues of early child education and the right to it, which there is a right. Ms. Sharma made a very, very strong point about the explicit mention of the right to early education not being part of 4.2, but there's a lot of evidence now that it actually is a right, and that the Special Rapporteur for Education is in the process of providing guiding principles around that right. But we can come back to that if we have a moment. But just to say how much 1 year of preschool education matters, and don't worry about the data, but it just makes it matter, especially for maths. And if you have 2 years, the improvements are very striking. Don't worry about standard deviations. And interestingly, the effects are most notable in East Asia and Pacific countries. Next slide, please. So what kind of data we do need? I won't go into it. You all know this. We need morbidity, mortality. We need all the data that we need across the nurturing framework for children in the early years of life. And there's a list of a slightly expanded list, but it's the core of the nurturing framework. Next slide, please. So we've put together a large consortium to try and tackle this issue, and ARNAC are very much at the center of it. Even Santiago, your lead, is a key investigator, and we've already had important contributions from a range of people from ARNAC, Nalima, and Harry, who's represented the youth champions in this. And UNICEF plays a very important part. We've had climate and child experts from Oxford, but elsewhere as well. And an important part of it is the International Center for Equity in Health in Pelotas in Brazil, who've done a great job in collecting all the UNICEF mix and the DSH data sets. These are annual surveys, covered many countries of the world, and pulled them together, which will form the basis of much of this data. Next slide, please. So, just in case you're about to go to sleep, can somebody help me? What's this a picture of? Any? Yeah, we got it. Someone said Kathmandu. So what is it showing? It's showing the magnificent picture of the Himalayas in the background. I know that people talk about the Himalayas, but Himalayas, to me, in the background. But in the foreground are the brick kilns, which are billowing out smoke, which the northern part, as many of you know, of India, Bangladesh, Nepal as well, and Pakistan provide over 20% of the world's bricks, 340 billion bricks a year. But for 1% of GDP, Nepal puts out 13% of their own carbon dioxide emissions. These brick kilns are the responsibility of the world because it's about demand and supply. So it's not an issue for Asia, that part of Asia alone. It's an issue for demand. But the impact of this is enormous. For a start, they are contributing to the melting of the glaciers in the Himalayas. And they relate to a whole range of problems in terms of health. We know that there's a very clear map of childhood respiratory infections, which maps very neatly across the brick kilns industry. And the brick kiln, and amongst many other things, higher rates of stillbirth, many other issues. I won't go into the issues of child labor, but that's a very big part of this. And it's something that really needs to be addressed, and many of the countries are beginning to address it, and there are laws that are beginning to change, and the big part of it is there is a solution because there are brick kilns which don't necessarily do this, which the Chinese have adopted. But I just wanted to give you an example of how the world needs to work together to worry about these kinds of emissions, which affect large parts of the globe. Next slide, please. So this is just a tiny slide. Don't worry too much about the messiness of it. But I just wanted to show you this from the study which I mentioned, which is looking at children's sleep. Don't worry too much here. But what it's showing on the left-hand side, just worry about the two left-hand tables, figures, should I say. These are the 8 kinds of children's sleep across these children's development that I mentioned before, across these multiple countries. And what they show is that the differences, there's about the amount of difference between children that is due to where children live in terms of sleep is quite substantial, the differences in sleep patterns. But when you take account, so that's the blue bit on the top left-hand panel. But when you take account of temperature and length of day, most of that bottom panel disappears. That's not proof of climate change, but what it's suggesting is that our environment contributes very substantially to children's development and to something like sleep, which is very important. I hope I haven't confused you. Next slide, please. So this is what we're trying to do. We're trying to generate evidence about the impacts of climate change, but in a very differentiated way, trying to look at who is most at risk, what the risks are, what the time places, and trying to narrow it down to smaller ranges of communities. We want to then use the evidence to engage policy levers and working with governments, and then generally raise the global visibility of climate change and its impact on children, and really deepen our established partnerships so that we all work together on this really deepening and worsening problem that we're all facing. Next slide. So this shows you where these data sets emerge from. They're mostly in low-middle income countries. We've got multiple data sets from different countries, but we've got 489 nationally representative surveys across 124 countries, representing 8 million women, usually mothers, and over 5 million children. So it's a wonderful opportunity. But what we need to do, and when I say we, I'm being immodest, because the clever people were going to link this to the climate data. But this is not an easy task. If we can have the next slide. It links to the most complex set of climate data. The climate and planetary data experts are able to give you a differential of 1 degree centigrade almost anywhere in the world across 2 kilometers and link this to the data. So what they're able to do is link through algorithms individually to each child, of the 8 million, 5 million children, that climate data that belongs to that child over whatever period you want. It lasts 2 months. If you think it's something like concentration, maybe it'd be 2 months. If you think it's stunting, it's the last 2 years, and do it across a lot. It's a massive job, but it can be done, and will give us a unique opportunity to really track what is really happening. And one of the big focuses will be the Asia Pacific and a large part of our collaboration with yourselves. But the African countries will also be involved, and there will be some from our income countries and certainly from Europe as well. Can I have the next slide, please? So this is just an example of what could be done, and now we're going towards the local. I should have said one of the reasons for getting into such detail is because it does help you track to the most local areas, to small areas of the world, which will really be able to inform local government. But this is data from the planetary experts. What they basically use is what we call fused planetary data. So they basically use NASA and all sorts of data where they take hundreds and hundreds of satellite data and put it all together in a fused set. And this is what happened. Their work during the Pakistan floods, we obviously didn't confine to Pakistan, moved across to India and Bangladesh in 2022. And it begins to show what is happening in the left there, with where the floods were, I won't get into that, and where people move. So you can see the movement of people at the floods at the same time. Next slide, please. But then what they're able to do is look at where schools, hospitals, and clinics are operating and where people are. So you can see where schools are no longer working, hospitals are no longer working, clinics are no longer working, and where those that are. This was originally just an academic exercise to see how you could do it. But the real advantage is for future disasters around the world is this could easily be communicated in real time to governments, and especially local governments on the ground. But in addition to that, the climate experts are able to predict quite substantially within a reasonable amount into the future where things are going to go wrong and where the disasters are going to be, and will allow governments, and local governments in particular, to plan where their critical assets are, where the key schools or key preschools or key creches are that they can maintain, which are on higher ground, which might need reinforcing, where the hospitals and clinics are, and to use the financing systems in advance of the disasters to protect these hospitals and clinics, rather than wait. And as a sort of random example, I know slightly different, but like after the Turkish and Syrian earthquake, everybody scrambled to get assistance. But at that point, it takes 6 months to get your survey done, your estimates done, and another 6 months to get the money or the support to the families who need it, whereas this can be done in advance. This planetary data also allows you to look at things like malaria. So you can get prediction as to where malaria is going to occur by using heat and humidity, and track where humidity might strike, and use and perhaps have vaccinations or increased bed nets or whatever is necessary in those particular places. Next slide, please. So just to mention the things that I don't want to even begin with what I'm saying here, because I've witnessed so many brilliant examples that are done by so many of you here about climate education. But obviously, climate education for children, empowering children, having their voices, and part of the solution will be part of what we want to do in using this data. So obviously, and I've seen fantastic examples of the development of education materials, art, and the importance of parental caregiving education. Next slide, please. So this is just some work by our colleague Ashima Gulati, who's done this work around landfill areas in the area of Delhi, using art and animations, amongst many other things, to work with children and to empower them to find their own solutions, and to work with local government, who've been very responsive, actually, to the work that they're doing. And then one more slide, I think. How am I doing in time? Have I got a couple more minutes? Do I have a couple of minutes? Okay. So I just wanted to say something about the right to education, because this is something that's also been concerned, this collaborative, and part of the collaborative of the 4 early childhood development networks. So what we did was as was pointed out, it's not mentioned explicitly in 4.2, and it's not mentioned as part of the right. It's not explicit in the Convention of the Rights to the Child. But every country has to put, every 5 years, has to write to the UN Monetary Committee to how they are dealing with the right to education, the right to persons with disability, the right to socioeconomic and cultural rights, and CEDAW, which is the protection of discrimination of women. On all 4 counts, at separate times, they write to put their report to UN. And the UN Monetary Committees then produce what they call concluding comments, which is a summary of whether this has been agreed to or not, or complied with. And we've reviewed all of these, hundreds of them, over the last 5 years. And what is completely clear is that the UN regards early child education as an absolute right. And the data is right there from the UN itself. So there are a number of ways to try and enshrine this, and we've had a lot to do with with UNESCO. UNICEF have helped, and it's many other people, and especially with the UN Special Rapporteur on Education. And they're now developing what's called guiding principles, which will explain exactly how this right should be interpreted and the right should be implemented, and includes, the exact details that I'm not sure, but includes the rights of people with disabilities to early child education in these rights. And they have, it might be finished now, but they have put this out to consultation. Just finally, this is a picture of the Amazon, because the world has chosen Belém at the mouth of the Amazon for COP30, and there is a Belém Health Action Plan, which is the Brazilian attempt to at least bring health and develop much more into COP, and there is lots of opportunity for input, and we are certainly inputting into this and will into the subsequent ones. Thank you again for this very special opportunity.